Today I am here with Dr. Ayoyemi. How are you doing today?
I'm good, thank you.
I want to start off by asking how your journey has been in becoming a doctor.
Well, it's been a long journey. Um, it's been a long journey and an unconventional journey. I had the aspiration to do medicine since the start of secondary school. I was quite determined and knew what I wanted and knew I had to do well at every stage of my academic career. But there were a few hurdles, and by the time I got to A level grade, I don't think I had the right support and mentorship. And I did a lot independently and I worked hard independently. But unfortunately, I didn't get a place at medical school. And I continued to work hard. And that hard work took me to studying biomedical sciences at Warwick, which was a lovely 3 years, an intense course, a course of depth. And it gave me a wealth of knowledge and opportunity. And from there on, I was able to do work and prepare myself to reapply for medicine, which I did 2 years post graduating at Warwick. And I was admitted to, I got admission at Sheffield University, where I studied undergrad medicine for 5 years. So if you total it up from 18 to graduating, it took 10 years. I met many people in the same boat as me on the journey, who experienced the challenges of getting into medicine in the early 2010s as difficult. And yes, this is how I got here.
Great and interesting journey. My next question is, what is your regular day as a doctor?
My regular day-to-day basis as a doctor, well, it depends where I'm posted. As a foundation year 1 doctor, I can be placed on my usual ward, which I'm doing currently on care of the elderly, or I could be placed in the ambulatory care unit, which is a triage version of emergency medicine, where you see people who are more likely to be admitted to the hospital for longer term assessments. So if I'm on the wards, my day is to start at 9 a.m. with a handover. So the nurses present all the patients. Then I go see the patients. I read up on their notes. I know their histories. I talk to them. I examine them. Sometimes it can be focused on a focus examination based on their complaint. And then I make a management plan, and I can do this with the consultant and discuss it, or do it myself and then discuss it with the consultant. It's been a steep learning curve, getting this new responsibility, but it's been a great one.
Were there any moments in medical school where you questioned whether you were on the right track?
I think a lot of students in university and especially medical school have something called imposter syndrome. So yes, I definitely question myself if I was on the right track at times where the knowledge was, overwhelming and the content was too much and there was so much to balance, especially as I was working part-time to fund the course at the same time. I definitely did question that, but when you realize that your peers are asking them the same questions, it reassures you that it's just a moment that will pass and you can get through it.
Right, and where do you see your career going then?
I see myself in the next 2 years entering core surgical training. And once I've completed that, I will pick a surgical career. High on the list is trauma and orthopedic surgery, because I like the challenges and the excitement that comes with trauma, and I like the simplicity and the fun culture that is associated with orthopedics. And when I say simplicity, I don't mean that the course or the training is simple at all, because it is absolutely not. But I mean, I like the medicine, the knowledge side of it seems to be something I would gravitate to. out of all the other specialties available to me. Where else? I also see myself starting a business. I will determine that in the next 5 years. And alongside my career growth, I would hope to progress in my family life and build a family and see my family members succeed and thrive.
Thank you for that insight. As you know, here at Health Unlimited, we're all about giving insight into people's experiences with the healthcare system, with medicine. So I'm curious, as a Black doctor, have you ever experienced racism during your career or training?
Absolutely. I experienced racism at school, going to predominantly white schools, which is expected in England, but then you don't think about the teachers that might have biases against young Black girls at the time who associate you as not worthy or smart enough. And that if impacts the predicted grades they send off to universities, that impacts how they treat you. It impacts how much effort they put into your career growth and supporting you. And I think that I definitely experienced moments of that where I was working very hard in my sciences and my biology teacher kept predicting me B's, even though every mock I was producing A stars. And it was frustrating because I knew that her predictions could have a negative consequence on my applications. And I definitely felt the consequence of that action. And that was because of a microaggression early in my career. And um, within medicine, you definitely experience um, doctors and patients who are not used to being around Black British female doctors. And that is a challenge in itself because people would like to comment on your heritage and where you're from and your hair. And they ask you questions that have nothing to do with why they're in hospital. But again, we move on.
And do you feel that your career could be impacted if you do speak up about this prejudice?
It could happen because when you are outnumbered, it's scary and people don't like being called out about their bad behavior. But it's something that has to be done because the people before us did it. I would not have the opportunity as a Black woman to be in higher education, to be in medicine, if someone else didn't stand up and speak up for what was right. So I have no choice but to.
And what would you say to your colleagues who may think racism doesn't exist in the medical profession?
I would ask them to open their eyes and take a look at what's going on outside of themselves, take a deeper look at how people are spoken to, um, the expectations put on them. Um, are people a bit harsher with people of ethnic minorities or people of Black ethnicity? Because within medicine, especially, the minority is Black people. And I would ask people to take a closer look and really, really focus and listen to other people's experiences because it 100% exists.
Yeah, definitely. Thank you for that. Now, so far, our questions have been focused on your experiences as a doctor in the medical profession. But do you have any memorable experiences as a patient as opposed to a doctor?
Yes. There was one time at when I was at Warwick and I went to see the doctor about some skin lesions I was experiencing, and at the time I didn't know what was causing it. And the nurse, I saw a nurse, but advanced nurse practitioner, which is someone who has been a nurse but has, gained the qualification to prescribe and make clinical judgments, almost like a junior doctor. And she saw me and she said, "Yes, I see these lesions on your skin, but it doesn't matter because you're dark skinned, so no one will notice it. No one will notice these lesions and it's okay. So you can go about your day." And she dismissed my concerns. it took me having to evaluate my own life and monitor what was going on in my body to realize I was having bad reactions and sensitivities to certain food products. Um, gluten and dairy, and me having to go back to my GP in London and say I need an intolerance test. But it's so strange to me that someone would look at your skin color and say, because you don't look like me, no one's going to notice it. Whereas if it affected a white person and it looked red and harsh and scary, they would have taken it more seriously, and that's a shame.
Yes, and it's quite frustrating because it's quite common and, to be honest, quite obvious that symptoms don't appear the same on everyone. And it's not good enough that there are still people in the medical profession that don't acknowledge that. So, why do you still think there are inequities within the NHS?
Because what we are taught to look at things from a Caucasian perspective. Symptoms and the pictures that we learn with are based on Caucasian skin, not brown skin, not black skin. Um, and sometimes people can't think outside of themselves. They don't think, if your experience is foreign to them and they don't get it, they just think they can minimize your experience. They don't ever consider that the world is bigger than themselves, if that makes sense.
Yeah, I understand. So, do you think then that the NHS has to take action? Is it up to the NHS?
Without doubt, because this country is very diverse. And not just that, but if action isn't taken, you're putting people's lives at risk. You need to know the people you are treating. And the thing is, we also have to remember is that the people who work within the NHS are very highly skilled people that can work worldwide. Nurses and doctors and healthcare assistants can volunteer or move across countries to share their skill set. You need to know medicine for more than just your local population or yourself. You need to know what medicine is for brown people and black people and disabled people and so on.
Yeah, and prejudice is nuanced. I've asked you about the prejudice you've experienced due to your race, but you are a black female doctor. So I'm curious, have you ever faced misogyny as a doctor or in your training, or more specifically, would you say it is misogynoir?
Um, Both misogyny, misogynoir. I think patients, even female patients, don't realize that when I introduce myself as a doctor, it means I'm a doctor and not a nurse. And I think people have so many preconceptions about what a nurse looks like that they continuously say nurse, nurse, nurse. And I respect the nursing profession highly, but I think there is a stereotype of what a nurse looks like and what a doctor looks like, and patients fall into that. And even when patients and their family members acknowledge that you are a doctor, and they can see that written on your lanyard very clearly, they can still refer to me as the lady. The lady said this, the lady's come to talk to you. And you sit there and you think about it, and if this was a male, young white male of the same age as me in this situation, they would refer to him as doctor without doubt. And um, while it may seem like a small thing, there is definitely something disheartening about our credentials being ignored because we don't look a certain way.
Yeah, I agree. And it's interesting that you say that because I've seen a news report on about some sort of zoning commission meeting where the zoning commissioner refused to call a black female doctor. He would just say her full name and she would reply repeatedly saying, "Please call me doctor." And he would ignore. And she would ask it again and again until he finally reduced her full name to only her first name. And it just goes to show that there are many occurrences of this where people feel the need to strip the credentials away from a black female doctor, and it's simply not okay. And it links to my next question of, do you feel respected as a doctor?
Not yet. I don't know if it's age, I don't know if it's race, and I don't know if it's gender. Not yet is my only answer. I think age and experience will impact how I carry myself and how I look, and then maybe that could make patients and colleagues see me as a doctor, because one thing newly qualified doctors can agree on is even the nurses don't always treat you as the doctor. They don't acknowledge your qualifications. So it's very hard to distinguish what is the cause at this stage in my career.
Well, on a more positive note, what would you say you like most about the medical profession?
I really enjoy scientific knowledge. I really enjoy being able to take that knowledge and apply it to people, diagnosing them, managing them, treating them, and so on. I really am an academic at heart, and that's what I like about the medical profession. And then when you do have patients and their families who come up to you and they say, "Wow, thank you, doctor. You've been tremendous. You've been amazing. You are diligent. You have listened." When you have people do that, it really, really makes a big difference, and it's incredible.
So you would say you definitely appreciate when patients show gratitude.
Yes, when they see the hard work you put in, and um, they express that you've made a difference in their lives.
Okay, now my next question is, what do you have to say to the youth who want to study medicine?
Whew, wow, that's a big question. Medicine is an incredible, incredible career and profession. I don't know. It's hard to separate the NHS from a career in medicine in this country, because we all know that the NHS is struggling financially and is at capacity, and staff are leaving the NHS. But medicine, as its own category, wherever you are in the world, it's a beautiful profession, and I highly recommend it. And I'm really happy to be a doctor. And I just hope that the NHS can get better over time.
I hope so too. What are your hopes for the future of medicine, Dr. Ayoyemi?
I hope that the conditions we are seeing arise in, the conditions that are causing long term disabilities and reduced quality of life, I hope that we get some control over that. So I'm including type 2 diabetes and heart failure and cardiovascular diseases and hypertension, the conditions that are causing reduction in quality of life in people. I really hope that can prevent those things in the future and have better treatments for those things, because it's very hard to see the same people coming back regularly, suffering. I hope that answers your question.
Yeah, it does. Now, I guess more specifically, what are your hopes for the future of the healthcare system?
I hope that when black people, I can only speak for black people as a black person, but when black people enter the work environment or they come as patients, they are treated correctly, they are listened to, and there are the correct procedures are in place for health benefits, and that people don't treat us with negative biases and withhold pain relief, or I don't want to see statistics about black women having a higher mortality in pregnancy and birth. I definitely want to see healthcare being more accessible and safer for Black people.
Yeah, me too. Now, as you know, this is Health Unlimited. So, my final question for you today is, how do we lift the lid off the medical profession and healthcare system to make it more equitable and inclusive? How do we do it?
That is a tremendous question. I think we need to put effort into research and investigating these questions that we have. We need real life statistics, real life evidence that no one can deny. And that means, quality improvement projects and audits and questionnaires out to the people who are impacted by health inequality. And once we see the problem clearly in real life and in research, then we can start making a plan on how to fix it and educating the people involved in healthcare and the people who access healthcare.
I second that. Thank you so much, Dr. Ayoyemi, for talking with me today. It's been great interviewing you. It's been great getting your insight. I really hope that your voice is heard by many others and we can create change and lift the lid. Thank you very much.
Thank you for interviewing me today.